Yeah, hi everyone. Good evening. Can you confirm if my voice is audible? Yeah, good evening, Srilata. Yeah, it's clear. Clear, kada? Okay, nice. Okay, we'll just continue from where we left. Manamu sympathetic and parasympathetic. Yeah, good evening, Shweta. So we're looking at sympathetic and parasympathetic system, and a few points I want to complete. And let us see. Okay, the sympathetic system is also called as the sympathetic system is also called as no, yes. Sympathetic చూడలేదా మనం? Yeah, okay, adrenergic system, flight or flight hormone. Okay. Okay, let me rephrase. Let me rephrase. Yeah, yeah. Salma, correct. Um, the voice is clear, right? You can you can confirm that once. Nagaraju, ఒకసారి మీరు confirm చేయగలరా? If my voice is clear. Yeah, thanks, Swapna. It's audible, right? Okay. Yeah, Dinesh, I think you will have to check it at your end. Okay. Yeah, so thoracolumbar outflow is basically sympathetic outflow. And what are the cranial nerves that supply for parasympathetic nervous system? Which cranial nerves are part of the parasympathetic outflow? 3, 7, 9, 10. Okay, Anusha, nice. Yeah, 3, 7, 9, and 10. What other regions, which spinal nerves are part of the parasympathetic nervous system? Which spinal nerves are part of the parasympathetic nervous system? Yes, very good, Sahana. Sacral. Okay, sacral nerves. Simple. Okay, so sacral nerves are part of uh, parasympathetic nervous system. Where does the spinal cord end? Where does the spinal cord end? Yeah, yeah, T12 L1. Correct, right? Okay, and the thoracic region is also correct. Okay, so it ends. How many bones are there in the vertebral column? How many bones are there in the vertebral column? Yeah, correct. Saujanya, very well put. 33 bones ఉన్నాయి, but they have fused. No, 33 bones. Abdul, 33 bones have fused to form finally 26 bones. Okay, 33 have come together. They have fused to form 26 bones. So total number of axial bones ఎన్ని ఉన్నాయి? Axial bones, Shilpa. Total number of axial bones. Okay, 80. Okay, 80 axial bones. Okay, let us quickly get into. Yeah, that's okay, Shil. So let us quickly get into few points related to the bones. Okay, did we see bone function? We have not seen bone function, so we will see bone. We'll look at a little bit of bone function, and then we'll come back and see the sympathetic and parasympathetic system. Okay, ఎందుకంటే మీకు రేపు టెస్ట్ ఉంటుంది. అండ్ వాట్ ఎవర్ ఇస్ ద సిలబస్ ఫర్ ద టెస్ట్ మనం ఇవాళ వరకు ఏం కవర్ చేస్తామో అది మీకు రేపు టెస్ట్ ఉంది. ఓకే, సో వి విల్ కంటిన్యూ. ఎందుకంటే యాక్సియల్ బోన్స్ చూసాం కాబట్టి కొంచెం మనం అపెండికులర్ బోన్స్ కూడా చూద్దాం, బోన్ స్ట్రక్చర్ చూద్దాం, బేసిక్ ఫంక్షన్స్ చూద్దాం, అండ్ దట్ ఇస్ ఇనఫ్ యాజ్ ఫార్ as the syllabus is concerned. Okay, and then we will get into the basics of ANS. Okay, parasympathetic and sympathetic system. So if you can see my screen, um, oh, yeah. If you can see my screen, then just confirm if you're able to see my screen. Yeah, Monica, thank you. Yeah, thank you. So see, this is very interesting. మనకేంటి total number of bones, okay? total number of bones in the body. Okay, total number of bones. Total number of bones in the body are 206. Okay, there are 206 bones. ఈ 206 bones లో చిన్నప్పుడు in in a child which is born, actually in children there are 305 bones. Some authors say anywhere between 270, 280 నుండి 305 ఉన్నాయి. So 305 bones are present in children, which again fuse to form totally 206 bones in adults. Okay, 305 bones fuse to form, yeah, Ravinder, 270 to 305. That's the range. Okay, within that range, all these bones will fuse together to form 206 bones in adults. Okay, 270 to 305 is the range. Okay, Ravinder. So that will fuse together to form 206 bones in adults. E 206 bones low, we have already seen that the axial bones are 80. Okay, and we have seen the distribution of the axial bones. Now you look at the appendicular bones. Okay, the appendicular bones are 206 minus 80, which is equal to 126 bones are the appendicular bones. Okay, ఈ 126 bones, Srilata, are very easy to remember. Okay, మీరు ఒకటే గుర్తుంచుకోవాలి. Just follow what I am trying to say. జస్ట్ మీరు గుర్తుంచుకోవాల్సింది ఏంటంటే ఈ సెంట్రల్ బాడీలో ఉండేది యాక్సియల్ బోన్స్, ఇవి 80. ఓకే, ఫ్రమ్ ద స్కల్, దట్ ఇస్ క్రేనియం 8 బోన్స్ నుండి వర్టిబ్రల్ కాలమ్ 26 బోన్స్ వరకు, దిస్ ఇస్ 80. ఓకే, అపెండిక్యులర్ బోన్స్ అంటే అపెండేజెస్, అంటే సైడ్స్ లో ఉండే బోన్స్. ఓకే, when these bones which are present in the side, what you should simply remember is there are two regions in the body. Okay, there are two regions in the body. There is an upper region of the body and the lower region of the body. Okay, superior and inferior regions of the body. The upper region of the body lo, you have the hands, and lower region of the body lo, you have the legs. Okay, the upper limbs and the lower limbs, right? So you have the hands and legs, Monica. You very easily you should remember that in the upper part of the body, see this, in the upper part of the body and in the lower part of the body, the bones distribution is more or less identical. Similar ga untundi. They are more or less identical. Now you see this, there are two pairs of unique bones upper part lo, two pairs of unique bones lower part lo kuda there are two pairs of unique bones. Okay, ఇది గుర్తుంచుకోండి. Two pairs అంటే totally 4 ఉంటాయి, ఇక్కడ కూడా 4 ఉంటాయి. We will come to this little later. Now let us see the common ones. What are the common ones? My upper arm. Okay, my upper arm. Okay, na pai bhagam, చేతిలో ఉండే పై భాగం. So my upper arm, the bone which is in the upper arm is called as humerus. Okay, the bone in the upper arm is called as humerus. The humerus are two bones. Okay, my forearm, each hand has two bones. Okay, my forearm has radius and ulna. Okay, radius and ulna. Since there are two radius, two ulna, if I consider both my hands, okay, there are two radius and two ulna. Okay, then my wrist, okay, it is called as carpals. The carpals are 16, both hands put together. Okay, carpals are 16. Then metacarpals. Okay, metacarpals are 10. Okay, దాని తర్వాత ఈ digits, phalanges. Okay, phalanges are 28. Okay, phalanges are 28. This is in the upper. My upper arm rendu, my forearm, each hand 2 bones, radius and ulna. My wrist bones. Okay, my carpals are 16. My metacarpals are 10. My phalanges are 28. Okay. Corresponding bones, let us look at in the legs. My thighs, there are 2 thighs, the strongest bones. Okay, my thighs, which is called as femur, I have 2 femur. Okay, this is thigh bone. Okay, I have 2 femur. దాని తర్వాత ankle నుండి మోకాళ్ళ వరకు, just like your forearm, you have the foreleg. The foreleg is made up of 2 bones. Okay, it is called as tibia 2 and fibula. Just like radius and ulna, the foreleg is made up of tibia and fibula. Okay, tibia rendu, fibula rendu. Each foreleg is made up of 2 bones, one tibia and one fibula. Both the legs, you will totally have 2 tibia and 2 fibula. Then, ఇక్కడేమో కార్పల్స్ రిస్ట్, యాంకిల్ దగ్గర మనం టార్సల్స్ అంటాం. టార్సల్స్. There are 14 tarsals. This is the only difference. Here carpals are 16, tarsals are 14. Metatarsals are 10, phalanges are 28. See, everything is identical. ఇక్కడ హ్యూమరస్ 2, అప్పర్ లెగ్, దట్ ఈస్ యువర్ థై, ఫీమర్ 2, రేడియస్ 2, టిబియా 2, అల్నా 2, ఫిబులా 2, కార్పల్ 16, tarsals 14. This is the only difference. Metacarpals 10, metatarsals 10, phalanges 28, phalanges 28. Okay. When you look at the upper arm, upper part of the body, we said there are 2 pairs of unique bones. అదేలాగా lower part of the body లో కూడా 2 pairs of unique bones ఉన్నాయి కాబట్టి totally 4 ఇక్కడ కూడా identical గా ఉంది. But what are these 2 pairs of unique bones in the upper part of the body? One is scapula. మీరు చెయ్యి ఇలా వెనక పెట్టారంటే you will find a bone, shoulder కింద you will find a bone which will come out, which is called as scapula, which will help in the rotation of your arms. Okay, rotation of your arms. It is called as scapula. Okay, so you will have scapula, two scapula on both the sides. Then you have what is called as clavicle. The clavicle is 2. Okay, so that is your shoulder. Yeah, shoulder blade is your scapula, and clavicle is between your neck and that of the shoulder. So this T-shaped bone, okay, is called as collarbone, is called as clavicle. So you have 2 clavicles, okay, and then you have 2 scapula. అదేలాగా lower part of the body లో కూడా 2 pairs of unique bones అన్న. What are those? 2 bones make up the pelvic girdle. Pelvis or hip is made up of 2 bones. Okay, pelvic girdle or hip is made up of 2 bones, and then there are 2 bones which are called as the patella. Patella is nothing but your kneecap. You don't have any special bone in the elbow, but on the knees you have 2 bones which are called as patella. So if you count, you will get 28 plus 28, 56. Okay, 66, 76, 86, 96, 106, 106 plus 6, 112, 112 plus 4, 116, 116 plus 6, 122, 122 plus 4, total you will get 126. Okay, these are your very simple appendicular bones. So appendicular bones ని ఎలా గుర్తు పెట్టుకోవాలి అంటే you don't have to memorize anything. All you have to know is identical గా ఉంటుంది. There are 2 special bones in the upper part of the body, which is your clavicle and your scapula. There are 2 special bones in your lower parts of the body, which is your hip and your knee. Okay, so అది గుర్తుంచుకుంటే కాళ్ళకి చేతులకి there are identical ones. 2 upper arm which are humerus, 2 thighs, that is 2 femur, 2 tibia, 2 fibula, 2 radius, 2 ulna, 16 carpals but 14 tarsals. That is the only difference. 10 metacarpals, 10 metatarsals. You have 28 phalanges and 28 phalanges, which is common. So totally 126 bones are there as part of the appendicular. Okay, just take this down. Give me 1 second. You have taken this? Yeah? Okay. So now we will have to see the functions of the bones. Okay? We have to see the functions of the bones. Okay? Function of the bone చూసేటప్పుడు we will also see the structure of the bone. Okay? ఈ structure of the bone లో ఏముంటుందంటే, see this, very simple. The bone has this kind of a structure. You have the upper portion or the corner portion of the bone, and then you have a long connecting body of the bone, and then you have another portion of the bone, and you have the sides of the bone, and then this again has this kind of a connection, and then you have a inner slightly hollow region, a cavity, which is present like this. Okay. The outer part of one of the bones, you have to understand that there is a joint that can happen. A joint ఉంటుంది కాబట్టి articular cartilage ఇక్కడ ఉంటుంది connecting to the. Okay. General structure of the bone is something like this. So ఈ bone లో మనకి ఏం కనపడుతున్నారు? Okay. What you will see is in this bone, this long part of the bone is called as diaphysis. Okay, this is called as diaphysis. So when the bones are growing, it is basically the diaphysis which keeps elongating, right? So this is called as diaphysis. At this particular juncture, okay, at this particular juncture, when you are young, there is a region here, okay, when you are young, there is a region here which is called as, this is called as epiphyseal cartilage. This epiphyseal cartilage ఉన్న భాగం, this particular region is nothing but, it's the same region, is nothing but it is called as metaphysis. Okay, there are two metaphysis. Okay, that is joining the long diaphysis, and it is joining the diaphysis with the epiphysis. Okay, the metaphysis is a very thin region joining the epiphysis with the diaphysis. ఈ మెటాఫైసిస్ లో ఎపిఫీషియల్ కార్టిలేజ్ అన్నది చిన్న యంగర్ ఏజ్ లో ఉంటుంది. యాజ్ యూ స్టార్ట్ అడ్వాన్సింగ్ ఇన్ ఏజ్, ఈ కార్టిలేజ్ విల్ స్టార్ట్ డిజాల్వింగ్. ఇది కంప్లీట్ గా డిజాల్వ్ అయిపోయి ఇక్కడ ఏంటి, జస్ట్ ఒక లైన్ ఉంటుంది. ఇక్కడ కార్టిలేజ్ ఇంక ఉండదు. ఓకే, ఇటుపక్క అయినా సరే ఇటుపక్క అయినా సరే జస్ట్ ఒక లైన్ ఉంటుంది, కార్టిలేజ్ ఉండదు. ఎప్పుడైతే కార్టిలేజ్ పోయి ఒక లైన్ వస్తుందో అప్పుడు దాన్ని మనము ఎపిఫీషియల్ ప్లేట్, సారీ ఎపిఫీషియల్ లైన్ అని చెప్తున్నాడు. ఎపిఫీషియల్ లైన్ అని మనం చెప్తున్నాం. ఎపిఫీషియల్ లైన్ ఏంటి? ఎపిఫీషియల్ లైన్ ఇస్ నో లాంగర్ కార్టిలేజ్. ఈ ఎపిఫీషియల్ లైన్ ఇస్ బోన్ ఇట్ సెల్ఫ్. జస్ట్ అది బోనే. ఇంకా ఎపిఫీషియల్ లైన్ అన్నది ఇంకా బోన్. కార్టిలేజ్ అంటే ఏంటి? ఆర్ ఇయర్స్. దిస్ ఈస్ మేడప్ ఆఫ్ కార్టిలేజ్. టిప్ ఆఫ్ ద నోస్ is made up of cartilaginous joint. Okay, this is cartilage. Ears are made up of cartilage. It is not a bone. So metaphysis లో ఫస్ట్ ఎపిఫీషియల్ కార్టిలేజ్ ఉంటుంది. ఆ ఎపిఫీషియల్ కార్టిలేజ్ పోయిన తర్వాత ఆ చోట అది బోన్ గా కన్వర్ట్ అయినప్పుడు ఒకప్పుడు ఇక్కడ కార్టిలేజ్ ఉండింది అన్నందువల్ల ఒక లైన్ లాగా ఉంటుంది, విచ్ ఇస్ కాల్డ్ యాజ్ ది ఎపిఫీషియల్ లైన్. ఓకే, that epiphyseal line also belongs to metaphysis. Metaphysis ante the middle region between epiphysis and diaphysis, that is metaphysis. Okay, The outermost region is called as periosteum. The inner region is called as endoosteum. The canal which is present here is called as bone marrow. The canal which is present is called as bone marrow. బాడీలో బ్లడ్ వెసల్స్ హ్యాపీగా దే విల్ సప్లై ఇన్ టు దిస్ బోన్. బ్లడ్ వెసల్ వస్తుంది. ఓకే, వెయిన్స్ విల్ బ్రింగ్ అబౌట్ arteries will bring about oxygenated blood, and veins will carry deoxygenated blood. So this is oxygenated blood, red in color, coming through the artery, and deoxygenated blood going via veins. సో ఇది కంటిన్యూస్ గా బ్లడ్ సప్లై అన్నది ఈ ఈ యొక్క బోన్ లో అవుతూ ఉంటుంది. అండ్ బోన్ యొక్క ఆస్టియం సర్ఫేస్, ఈ బోన్ మ్యారో నుండి బయటకి రావడానికి అట్ సర్టన్ ప్లేసెస్ దెర్ ఆర్ స్మాల్ గ్యాప్స్ విచ్ ఆర్ ప్రెసెంట్ లైక్ దిస్. There are small gaps which are present, and these gaps which are present here are called as fenestrations. Okay, the gaps which are present here are called as fenestrations. Okay, fenestrations and gaps which are present. Okay, the gaps which are present are called as fenestrations. The bones in the body, okay, 99% of body's calcium is in bones. Okay, 99% of body's calcium is present in bones, and bones contribute roughly about 2% of body weight. Okay, the bones అంటే the calcium which is floating, only the calcium, 2% of the body weight. Okay, Ca2 plus calcium contributes to 2% of the body weight. Okay, just the calcium component. Okay, it contributes to about 2% of the body weight. 99% of the calcium is found in the bones. Okay, the calcium which is found in the bones, most commonly ఈ కాల్షియం ఏమవుతుందంటే, ఈ కాల్షియం అన్ని కూడా బోన్ గా ఫామ్ అవుతుంది. ఈ బోన్ లో దేర్ ఇస్ ఏ కాన్సెప్ట్, ఏ ఫినామినన్ కాల్డ్ యాజ్ రీమోడలింగ్ అనే ఒక ఫినామినన్ అవుతుంది బోన్ లో. రీమోడలింగ్, ఈ రీమోడలింగ్ ఏంటంటే, ఈ కాల్షియం అన్ని కూడా తీసుకొచ్చి బోన్ లో పెట్టడము, మళ్ళీ ఎప్పుడు బాడీకి అవసరం ఉందో ఆ కాల్షియం ని బోన్ నుండి తీసుకెళ్లి రక్తానికి ఇవ్వడం. ఓకే, సో దేర్ ఇస్ ఏ ప్రాసెస్ కాల్డ్ యాజ్ అడ్జార్ప్షన్. Okay, adsorption, and there is a concept of resorption. Okay, resorption, absorption and resorption. Adsorption అంటే calcium ని తీసుకురావడం towards the bone. Resorption, taking away calcium from the bone. Okay, this is continuously happening, adsorption and resorption. The cells which are favoring adsorption are called as osteoblasts. Okay, the cells which are favoring resorption or decrease in the calcium inside the bone and release of the calcium from the bone into the blood, okay, are called as osteoclasts. Okay, osteoclasts. Osteoblast helps in adsorption. Osteoclasts help in resorption. Okay, రీమోడలింగ్ అన్నది అవుతుంటుంది. అంటే కొత్త కాల్షియం వచ్చి చేరడము, అగైన్ కాల్షియం ఫ్రమ్ ద బోన్స్ విల్ కీప్ గోయింగ్ బ్యాక్ ఇన్ టు ద బ్లడ్. Again calcium keeps coming in, again calcium keeps going out. So continuously there is a cyclic remodeling that is happening with regards to calcium in the bones. Okay, adsorption, resorption, adsorption and resorption. The calcium which is present inside the bones ఓకే. మనస. బోన్స్ బాడీ బ్లడ్ నుండి కాల్షియం అన్నది అక్యుములేట్ అవుతూ ఉంటుంది. బోన్స్ అంటే నథింగ్ బట్ మాస్ ఆఫ్ కాల్షియం. సో ఎప్పుడైతే బోన్స్‌లో కాల్షియం వస్తుందో అప్పుడు దెన్ దట్ ప్రాసెస్ బ్రింగింగ్ కాల్షియం టు ద బోన్స్ ఈస్ కాల్డ్ యాస్ అడ్సార్ప్షన్. రిమూవింగ్ కాల్షియం ఫ్రమ్ ద బోన్ ఈస్ కాల్డ్ యాస్ రిసార్ప్షన్. Okay, we will see this. The calcium which is present inside the bones, many times it is forming a salt with phosphate to form calcium phosphate, Ca3PO4 twice. Okay, most commonly it is stored as calcium phosphate. This calcium phosphate, 3 units of this calcium phosphate will generally combine with 1 unit of calcium hydroxide. This is also present in the body. Okay, 3 units of calcium phosphate will combine with 1 unit of calcium hydroxide to give something very interesting, which has a molecular empirical formula Ca10, PO4 taken 6 times, and OH taken twice. See this? Ca10, PO4 6, OH twice. ఎందుకంటే Ca3, PO4 3 సార్లు తీసుకుంటే Ca9 అవుతుంది, PO4 6 అవుతుంది. ఆ Ca9 తో పాటు ఈ Ca కూడా యాడ్ అవుతుంది, కాల్షియం హైడ్రాక్సైడ్. సో టోటలీ Ca becomes 10, PO4 becomes 6, and OH becomes twice. This Ca10, PO4 6, and OH twice is called as hydroxyapatite. I'm writing in green. Okay, it is called as hydroxyapatite. Okay, this is called as hydroxyapatite. ఈ హైడ్రాక్సీ అపెటైట్ ఏం చేస్తుంది? ఈ హైడ్రాక్సీ అపెటైట్ ఫర్దర్ ఫ్లూరైడ్, మెగ్నీషియం, మోర్ కాల్షియం, మోర్ మినరల్స్ బ్లడ్ నుండి అన్నిటిని అట్రాక్ట్ చేస్తూ ఉంటుంది. ఓకే, సో ఇవన్నీ అట్రాక్ట్ చేయడానికి మోస్ట్ ఇంపార్టెంట్ సబ్స్టెన్స్ విచ్ ఇస్ ఫార్మ్డ్ ఇన్ ద బోన్ ఇస్ హైడ్రాక్సీ అపెటైట్. ఈ హైడ్రాక్సీ అపెటైట్ ఎలా ఫార్మ్ అవుతున్నది? 3 కాల్షియం ఫాస్ఫేట్, 1 కాల్షియం హైడ్రాక్సైడ్ మిక్స్ అయ్యి యూ ఫార్మ్ దిస్ hydroxy apatite. This hydroxy apatite is bringing all the minerals from the blood more and more into the bone, and it is solidifying the bone. Bone is becoming more and more solid. It is solidifying this bone. It hardens the bone. It provides the strength to the bone. Okay. So hydroxyapatite is a very important ingredient with an empirical formula Ca10PO4 6OH twice. This is going to bring in all of these elements to the bone, and it hardens the bone. Okay. Yeah. Fluoride comes in. Okay. Magnesium comes in. More calcium comes in. Maybe more calcium hydroxide comes in. All these things will come and they join the bone, and bone becomes more and more stronger. Okay. సో బాడీలో ఎలా అంటే, ఇఫ్ యూ స్టార్ట్ యూజింగ్ ద బోన్స్, మీరు బోన్స్ ని బాగా వాడగలిగితే అంటే ఏంటి? మీరు పరిగెట్టి ఫిజికల్ యాక్టివిటీ చేసి, ఫర్ ఎగ్జాంపుల్ అథ్లీట్స్. ఓకే, ఇది యుఎస్ లో ఈ యొక్క ఈ యొక్క కంపారిజన్ చేశారు. అథ్లీట్స్ అండ్ ఆస్ట్రోనాట్స్, నాసాలో పనిచేసే ఆస్ట్రోనాట్స్, వాళ్ళిద్దరికి మధ్యన ఉన్న బోన్ డెన్సిటీ డిఫరెన్స్ ని వాళ్ళు టెస్ట్ చేసి చూశారు. అథ్లీట్స్ ఎవరైతే పరిగెట్టి ఆడుతున్నారో, లేదా ఎవరైతే దే ఆర్ పార్ట్ ఆఫ్ ది హూఎవర్ ఇస్ రన్నింగ్ అరౌండ్ అండ్ హూఆర్ ఆర్ అథ్లీట్స్, అటువంటి వాళ్ళకి బోన్ డెన్సిటీ అన్నది చాలా థిక్ గా, స్ట్రాంగ్ గా, అండ్ బోన్ ఇస్ వెరీ డెన్స్. లాట్ ఆఫ్ థింగ్స్ ఆర్ అబ్జార్బ్. సో బోన్స్ ఎట్లా అంటే, బాడీ ఎట్లా అంటే, ఇప్పుడు బోన్స్ ఎక్కువ మీరు యూస్ చేశారంటే, అంటే పరిగెడుతూ ఫిజికల్ మూవ్మెంట్ ద్వారా బోన్స్ యూస్ చేస్తే ఇంకా ఇంకా కాల్షియం అండ్ ఇంకా మినరల్స్ ని తీసుకొచ్చి ఆ బోన్ ని ఇంకా హార్డన్ చేయడానికి చూస్తుంది బాడీ. కానీ మీరు బోన్స్ ని వాడట్లేదు అనుకోండి, ఇఫ్ యు ఆర్ నాట్ డూయింగ్ మచ్ ఆఫ్ ఫిజికల్ యాక్టివిటీ అండ్ బోన్ మూవ్మెంట్, బాడీ ఏం చేస్తుందంటే ఊరికే ఆ కాల్షియం ని తీసుకొచ్చి బోన్ లో పెట్టాల్సిన అవసరం ఏమున్నది? లెట్ us కీప్ దట్ కాల్షియం ఇన్ ద సర్క్యులేషన్ అనేసి కాల్షియం ని తీసుకురాకుండా ఆ బోన్స్ ని ఇంకొంచెం వీక్ గానే ఉంచుతుంది. బోన్ డెన్సిటీ అనేది తక్కువగా ఉంచుతుంది, ఎందుకంటే వాడట్లేదు కాబట్టి. సో ఈ ఆస్ట్రోనాట్స్ అందరూ వాళ్ళేంటి, దే పుట్ దేర్ ఆస్ట్రోనాట్ డ్రెస్ అండ్ వాళ్ళ స్పేస్ లో లేదా జీరో గ్రావిటీలో ఎక్కువ పని చేస్తున్నారు కాబట్టి ఇన్ దట్ జీరో గ్రావిటీ సిచ్యువేషన్ లో వాళ్ళకి అసలు బోన్ మూవ్మెంట్ అవసరం లేదు అక్కడ, బికాస్ దే ఆర్ డూయింగ్ సైంటిఫిక్ వర్క్. ఓకే, అంటే వాళ్ళు స్పేస్కి వెళ్ళాల్సిన అవసరం లేదు. ఆ నాసాలోనే దే ఆర్ మోస్ట్ ఆఫ్ ద టైమ్స్ దే ఆర్ స్పెండింగ్ దేర్ టైమ్ ఇన్ జీరో గ్రావిటీ. సో అటువంటి టైంలో వెన్ ద డాక్టర్స్ హ్యావ్ టెస్టెడ్ దే ఫౌండ్ దట్ ద బోన్స్ హ్యావ్ బికమ్ ఎక్స్ట్రీమ్లీ బ్రిటిల్ అండ్ లో డెన్స్. ఓకే, they have become extremely brittle and they have become less dense. Okay, and bones have become very weak, whereas athletes, while bone density has tremendously increased. Okay, so body has this tendency, ఇక్కడ మనం రీమోడలింగ్ అన్నాం కదా, ఎప్పుడు అవసరం అయితే అప్పుడు బాడీలో బోన్స్ ని స్ట్రెంథెన్ చేసి, ఎప్పుడు అవసరం లేదో అప్పుడు ఆ బోన్స్ ని అక్కడి నుంచి డిజాల్వ్ చేయడం అనేది, రిజాల్వ్ చేయడం అనేది, దట్స్ అ ప్రాసెస్. అండ్ కొన్ని సందర్భాల్లో, లైక్ ఫర్ ఎగ్జాంపుల్ ఇన్ సమ్ క్యాన్సర్స్, ఓకే, ఇట్ ఈస్ నాట్ పార్ట్ ఆఫ్ యువర్ సిలబస్, ఇన్ఫాక్ట్ ఇట్ ఈస్ నాట్ ఈవెన్ పార్ట్ ఆఫ్ ఎనీ B.Pharm సిలబస్. మేబీ మీరు క్యాన్సర్ గురించి పిహెచ్డి చేస్తున్నప్పుడు ఇది వస్తుంది. సో దెర్ ఇస్ అ క్యాన్సర్ కాల్డ్ యాజ్ మల్టిపుల్ మైలోమా. ఓకే, సో మల్టిపుల్ మైలోమాలో ఏమవుతుందంటే, బికాస్ ఆఫ్ దట్ క్యాన్సర్ ఆస్టియోక్లాస్ట్స్ యాక్టివేట్ అవుతాయి, చాలా ఎక్కువ యాక్టివేట్ అవుతాయి. అందుకు ఏమవుతుందంటే న్యాచురల్ గా పర్సన్ లో ఏంటి, రిజార్ప్షన్ అనేది అలా ఎక్కువ అయిపోతూ ఉంటుంది. అంటే బోన్ నుండి కాల్షియం అలా బయటకు వస్తూ ఉంటుంది బ్లడ్ లో. దే విల్ బి సఫరింగ్ ఫ్రమ్ హైపర్ క్యాలిసీమియా, కిడ్నీ స్టోన్స్ వస్తాయి. ఆల్ దీస్ కైండ్ ఆఫ్ కండిషన్స్, యూరిన్ శాంపుల్ తీస్తే ఎక్సెస్ అమౌంట్ ఆఫ్ కాల్షియం ఇస్ ఎక్స్క్రీటెడ్ అవుట్. బ్లడ్ లో దెర్ ఇస్ ఎలివేటెడ్ స్పైక్ ఆఫ్ కాల్షియం అండ్ దెన్ స్టర్నల్ పెయిన్ వస్తుంది అటువంటి పేషెంట్స్. ఓల్డ్ పీపుల్ కి నార్మల్ గా వస్తుంది. యావరేజ్ ఏజ్ ఆఫ్ దట్ క్యాన్సర్ ఇస్ సమ్వేర్ అరౌండ్ 67-69 years. సో 69-70 years కి ఆ క్యాన్సర్ వచ్చినప్పుడు ఇట్స్ అ టైప్ ఆఫ్ బ్లడ్ క్యాన్సర్. ఆస్టియోక్లాస్ట్స్ యాక్టివేట్ అయ్యి బోన్ రిజార్ప్షన్ అనేది చాలా ఎక్కువ అయ్యి బోన్స్ బ్రిటిల్ అవుతుంది. ఆల్రెడీ పీపుల్ ఆర్ ఓల్డ్. ఆన్ టాప్ ఆఫ్ ఇట్ హైపర్ క్యాల్సీమియా. ఆన్ టాప్ ఆఫ్ ఇట్ there is again kidney stones. And on top of it, what is happening is there is this kind of a resorption that is happening in case of multiple myeloma. It's an example. Okay, so the average age of diagnosis is 68-69 akkada. So at one time, average age is about 68-69. And then what happens is the patient is already suffering from cancer. The patient is old. And then there is osteoclast activation because of that cancer. And there is a rapid resorption of bone. And the patient complains of sternal pain. The patient complains of bone weakness. The patient falls down and bones start getting fractured very easily. Okay, then the doctor will think, okay, sternal pain, patient is falling down. What is the blood report? And in the blood report, if there is anemia and there are only high blast count, and then the urine shows a spike of calcium, many times it's a diagnosis for cancer, multiple myeloma cancer. Okay, so bone plays a very important role in the body, extremely important roles. Okay, now there are 6 important physiological aspects of the bones. Skeletal system, there are 6 very important aspects. Okay, so this 6 important aspects we will see. Okay, so as I said, all of this is contributed by the bone and bone density. Okay, so bone తాలూకు density వల్ల ఇది వస్తున్నది. బోన్ లో ఏంటి, మనకి 99% ఆఫ్ కాల్షియం ఆల్రెడీ ఉంది. కానీ బాడీకి ఎప్పుడు కాల్షియం కావాలో, ఆల్ ద టైమ్ ఫ్రమ్ ద బాడీ దిస్ కాల్షియం స్టార్ట్స్ గోయింగ్ ఇన్ టు ది బ్లడ్ స్ట్రీమ్. ఓకే, అండ్ ఎప్పుడు అవసరమో ఇట్ విల్ కమ్ బ్యాక్ ఇన్ టు ద బ్లడ్ స్ట్రీమ్. ఓకే, అండ్ ఇన్ సమ్ కేసెస్ ఇఫ్ ది ఆస్టియోక్లాస్ట్స్ ఆర్ ఓవర్ యాక్టివ్, బోన్ రిజార్ప్షన్ అవుతూ దెన్ ఇట్ విల్ స్టార్ట్ కమింగ్ డౌన్ స్లోవర్ అండ్ స్లోవర్ అండ్ స్లోవర్ అండ్ స్లోవర్. ఓకే, సో దిస్ ఇస్ ఎగ్జాక్ట్లీ వాట్ ఇట్ ఇస్ గోయింగ్ టు హ్యాపన్. Okay, so bone lo 6 important functions are there. Okay, there are 6 important functions of skeletal system. We will see. Okay, let me know once you have taken this down. Saida, it is just 99% of body's calcium is in bones. Okay, and calcium contributes to 2% of body weight. That's it. Just calcium alone. Okay, so what are the important things you have to remember? The bone parts are diaphysis, epiphysis, metaphysis. Okay, then there is something called as articular cartilage. ఒకటి రాసేస్తాను. You just note down. There is a cartilage here which is called as articular cartilage. What is diaphysis, epiphysis, sir? Farin, this is diaphysis. The bone has three parts. The long part of the bone is diaphysis. The ends of the bone is called as epiphysis. In between diaphysis and epiphysis is your metaphysis. That's it. These are parts of the bone, regions of the bone. You have an articular cartilage, you have periosteum, you have endoosteum, and you have a bone marrow. These are all the parts of the bone. Okay. So there are these three parts of the bone. Okay. Then there is no, Shilpa, there are 31 pairs of spinal nerves. We are not getting into that. Okay. All you have to remember is in the spinal nerves, in the thoracolumbar outflow, there is sympathetic system. Okay. The sympathetic system is called as thoracolumbar outflow. That should be. Okay. We don't have to get into the details of the 31 pairs. Yeah. Monica, osteoblast ante evaithe absorption chestayo that is osteoblast. Whichever helps in resorption, those cells which help in resorption is osteoclast. That's it. I've already put here osteoclast near resorption, osteoblast near absorption. Right. Okay, so from the bone, you have to talk about epiphysis, metaphysis, diaphysis, articular cartilage, periosteum, endoosteum, and bone marrow. These are the 7 regions you have to remember. Metaphysis low, there earlier there will be epiphyseal cartilage. Later on, that cartilage will go away and bone is formed to form epiphyseal line. This epiphyseal line is also part of the metaphysis. That is, it is between the diaphysis and epiphysis. That's it. Clear? These are the 7 points in structure you will have to remember. And then this bone is made up of hydroxyapatite. Hydroxyapatite is formed from 3 calcium phosphate and 1 calcium hydroxide. Okay. If you remember it like that, it becomes easy. If I directly put Ca10PO4 6OH twice, you may get confused. So you should simply remember that 1 calcium hydroxide CaOH twice and 3 calcium phosphate Ca3PO4 6 times. I mean Ca3PO4 twice. 3 into Ca3PO4, 1 into CaOH twice will give rise to hydroxyapatite. What does hydroxyapatite do? Hydroxyapatite will bring in all the minerals and helps in solidification and strengthening of the bone. It brings in fluoride, it brings in magnesium, it brings in other calcium and other salts of calcium. All these things will come into the bone and it will start making the bone denser and denser. There are remodeling of bone, resorption, adsorption. Adsorption is promoted by osteoblast, resorption is promoted by osteoclast. That's it. 80 is axial bones, 126 appendicular. This is the basic anatomy. 6 physiological functions ఉన్నాయి. ఇది తెలుసు your skeletal system, you will be, whatever question will come, generally you will be able to tackle. అంతే. Because what are they going to ask? They were going to ask you only direct questions. వాళ్ళేం మీకు ఇండైరెక్ట్ గా సైంటిఫిక్ రీసెర్చ్ కోసమో దేనికో వాళ్ళు అడగట్లేదు. యూ హ్యావ్ టు నో ద ఫండమెంటల్స్. అందుకనే వీళ్ళు అడుగుతారు. సో ఎనీ పార్ట్ ఆఫ్ ద బోన్ మనం ఏంటి డైరెక్ట్ గా ఇప్పుడు సూపర్ఫిషియల్ గా నేను చెప్పుకుంటూ పోయాను అనుకోండి. ఓకే, 126 అపెండికులర్ బోన్స్ ఉన్నాయి, 80 యాక్సియల్ బోన్స్ ఉన్నాయి, and then this is what it is. If I Ca10PO4 taken 6 times and OH twice, if I keep going that way, you will miss a logic. అదేంటి చాలా డ్రైగా ఏదో ఇన్ఫర్మేషన్ గ్యాదరింగ్ లాగా ఉంటుంది. So let us not do information gathering. Avasaramaithe we will just go a little bit to understand what it is, right? If you understand what it is, it becomes very easy. Tomorrow when you are reading pharmacology and medicinal chemistry, it becomes very easy. Otherwise, it will only be gathering of information. Information gather cheste emostundi meeku, right? It will only be like by hearting and you will forget. Okay, and then confusing ga untundi. Okay, few points we didn't go in detail. If the cranial nerve, for example, cranial nerve 9 అంటే ఏంటి అన్నది మనకి అది తెలియదు. కానీ కాకపోతే you may have to remember gag reflex is done by which cranial nerve. 99.9% they will not ask you that question. But It's just an interesting fact. Okay. Uh, just an interesting fact that where the gag reflexes is coming in, right? So gag reflex, and I said, okay, something goes into the head and we goes behind the neck and we have to spit it out. Yes. Tisindri Reddy, excellent. Glossopharyngeal nerve, Shruti, excellent. That's it. And what is the number of glossopharyngeal nerve? Nth cranial nerve, adi? 9. That's it. Okay. Cranial nerve 9, దాని పేరు బై హార్ట్ చేయాలి. నెవర్దలెస్. కానీ మీకు 99.9% క్వెషన్ 10th క్రేనియల్ నర్వ్ అంటే ఏంటి? ఇదే అడుగుతారు. నేను చెప్తున్నాను కదా మీకు ఒక క్వెషన్ క్రేనియల్ నర్వ్ మీద అడుగుతారు. కంపల్సరీ దే లాస్ట్ వన్ క్వెషన్ అండ్ ఇట్ ఈస్ వేగస్ నర్వ్. ఆ వన్ క్వెషన్ లో కూడా 80% ఛాన్స్ దే విల్ ఆస్క్ వాట్ ఈస్ ద 10th క్రేనియల్ నర్వ్. ఓకే. విచ్ ఇస్ ద లాంగెస్ట్ క్రేనియల్ నర్వ్? Yeah, which is the longest cranial nerve? Vagus nerve. Again, vagus nerve is the longest cranial nerve. Which cranial nerve does maximum? No, not trigeminal nerve. It is vagus nerve. Okay. Which is what do you say? Which nerve supplies to maximum part of the body's parasympathetic system? Again, it is vagus. Okay. Atu three, they'll ask the same question again and again. Okay. They'll again and again ask the same question. Okay. That it is vagus nerve. Okay. Vagus nerve is the most important nerve. With అడగొచ్చు అడగకపోవచ్చు. Maybe they may ask what is the second cranial nerve. ఎందుకంటే optic nerve is important. Okay, ఇలానే అడుగుతారు. మీకు already you know the names of these. Okay, beyond that I don't expect any question. అయినా కూడా ఎందుకు why should we know about trochlear nerve? It is doing a rotatory motion. For example, abducens nerve is the lateral muscle. ఎందుకు వస్తుందంటే it is just interesting. Okay, just name చదవడం కన్నా you just go one step beyond to understand and appreciate the subject. That's it. Okay. All right. You have taken this down? Okay. Okay. There are 6 important functions of the skeletal system. Okay. Very 6 important functions of the skeletal system. Interview. Number 1, giving support to the body. Okay. It gives support to the body. Body lo anni organs kuda they are considered to be soft tissues. Andike bone is very hard. Okay. Because bone is very hard, it gives a lot of support to the body. Okay. First and foremost is it gives support. Number 2, it gives protection. Ela protection. Cranium protects the brain. Vertebral column protects the spinal cord. Okay. Yesterday we saw spinal cord is different, vertebral column is different. Spinal column is different, spinal cord is different. Okay. I came across one student in the US. Okay, he posted a doubt. Okay, he posted a doubt to his professor. ఇది మనకే కాదు US లో కూడా the same doubt is there. He said, sir, I want to understand ఇదే ఈ కన్ఫ్యూజనే ఈ 33 bones 26 bones కన్ఫ్యూజన్ ఉంది కదా మనకి 33 కన్ఫ్యూజన్ అంటే ఇక్కడ కన్ఫ్యూజన్ ఏం లేదు 33 ఫ్యూజ్ అయి 26 గా మారుతుంది vertebral column లో. There are 33 bones in the vertebrae which will ultimately form 26 because the 5 sacral and 4 coccyx will fuse to form just one bone, continuous bone, right? His question was actually how many vertebral column bones are there? That is his question. But what he asked his professor is how many bones are there in the spinal cord? Simply his professor gave an answer, there are no bones in the spinal cord. Okay. There are no bones in the spinal cord. Why? Because spinal cord is different, spinal column is different. Spinal column or vertebral column is part of the skeletal system and spinal cord is part of the nervous system. Rendu completely different. So a supporting structure and the protection for the spinal cord is given by the spinal column. Right? So spinal column lo bones untai. Spinal cord lo there is no bones because spinal cord is nothing but nerves. Understand? Both are two different things and the spinal cord ends in thoracic region. Okay, T12 L1 region lo it ends. Okay, so that is why akkad nundi lopala vachegi only spinal nerves are coming out. Spinal cord ends in thoracic region, but the spinal column continues till the coccyx region. That entire vertebral column that is part of skeletal system. It's part of the axial skeleton. But spinal cord and brain are part of nervous system. They have nothing to do with the vertebral column. Vertebral column is just protecting the spinal cord. Okay, these are two different things. Okay. If somebody asks how many bones are there in the spinal cord? Yeah, spinal column and Pavan. Spinal column anna, vertebral column anna okate. It is part of the bones. Spinal cord is different. It is part of the central nervous system. Okay. So spinal column gives protection to the spinal cord. Cranium gives protection to the brain. Rib cage gives protection to the heart and lungs. Okay, all these things. So that is why protection is a very important aspect. The third important function, what are we looking at? We are looking at functions, okay, of skeletal system. Okay, physiology of skeletal system. Okay. Parinita, explain ante what we have covered. What do you want me to explain? Can you be very specific? Okay, so there is a support. Okay, and then there is protection. Okay, there is protection to the internal organs. Third important one is coordination of movements. Okay, there is a movement coordination. Of course, there is a movement coordination. Okay, there is flexion, there is extension. Right? Okay, there is flexion, there is extension. Okay, this is hyperextension. So all these movements can be coordinated with the help of skeletal muscles. Okay, and skeletal muscles where movement can be coordinated. Okay, skeletal nerves are part of, or the nerves which help in the movement are part of, what are they called as? The movement is called as peripheral nervous system. Peripheral nervous system lo, what exactly is part of it? Peripheral nervous system lo, where is it coming? Excellent, Sahana, right? Mamata. It is part of somatic. No, Sojanya, not Vegas. It is voluntary movement. Skeletal nervous system is voluntary movement. Movement another voluntary movement. It is part of somatic. Okay, it is part of somatic nervous system. మీ సిలబస్ లో ఓన్లీ ఏఎన్ఎస్ ఉంది, అటానమిక్ నర్వస్ సిస్టమ్ ఒక్కటే ఉన్నది. ఓకే, బట్ అటానమిక్ నర్వస్ సిస్టమ్ దేంట్లో ఉందంటే పెరిఫరల్ నర్వస్ సిస్టమ్. దట్ పాయింట్ యూ షుడ్ నాట్ ఫర్గెట్. ఓకే, సో మూవ్మెంట్ కానీ స్కెలిటల్ సిస్టమ్ ఇచ్చారు కాబట్టి మనకి మస్క్యులర్ సిస్టమ్, స్కెలిటల్ సిస్టమ్ మీకు అనటమీ ఫిజియాలజీలో ఇచ్చారు కాబట్టి మనకి మళ్ళీ పెరిఫరల్ నర్వస్ సిస్టమ్ ఇక్కడ చూడాల్సిన అవసరం ఉంది. నర్వస్ సిస్టమ్ పరంగా మీకు ఓన్లీ సెంట్రల్ నర్వస్ సిస్టమ్, అటానమిక్ నర్వస్ సిస్టమ్ ఇచ్చారు. కానీ సెపరేట్ గా ఏంటి స్కెలిటల్ నర్వస్ సిస్టమ్ అండ్ మస్కులర్ సిస్టమ్ అని ఇచ్చారు. సో అందుకు మనకి ఏంటి ఇక్కడ పిఎన్ఎస్ అండ్ దాంట్లో సొమాటిక్ నర్వస్ సిస్టమ్ అనేసి చెప్పారు. ఓకే, దట్ ఇస్ సంథింగ్ విచ్ వీ హ్యావ్ టు సీ. పిఎన్ఎస్ లో మనకి సొమాటిక్ ఉన్నది. Okay, we'll see that when we do the ANS, we will see it. Okay, so the third important thing is movement. The fourth important, what do you say, use of the skeletal system is mineral homeostasis. Okay, homeostasis ante function. Yeah, thank you, Nikita. Yeah, fourth important function is mineral homeostasis. Okay, mineral homeostasis. Homeostasis ante balance in the body. Mineral homeostasis. Enduku mineral homeostasis avasaramu? We already saw that ఒక్కసారి calcium, hydroxyapatite form అయిన తర్వాత it is attracting fluoride, it's attracting magnesium, it's attracting lot of minerals to solidify. Okay, so whenever body needs calcium, whenever body needs something from the bone, it will go. Bone నుండి వెళ్తుంది, bone కరిగి బాడీలోకి వెళ్తుంది, systemic circulation. Okay, so mineral homeostasis. Okay, so mineral homeostasis, hydroxyapatite we have already seen. So this is a very important point. Number 5, formation or production of blood cells. Extremely important point. Where is our blood produced? Where is our blood produced? Our blood is produced from the bones. రక్తం ఎక్కడి నుండి వస్తుంది? It is coming from bones. And inside the bone, if you see carefully, you have a region which is called as bone marrow. Okay, ఈ సెంట్రల్ రీజన్ ఇందాక మనం చూసాం, దిస్ ఇస్ కాల్డ్ యాజ్ బోన్ మ్యారో అన్న. ఈ బోన్ మ్యారోలోండి ఏంటేంటి వస్తున్నాయి? ఆర్బిసి, డబ్ల్యూబిసి, ప్లేట్లెట్స్, లింఫోసైట్స్, న్యాచురల్ కిల్లర్ సెల్స్, ఇవన్నీ కూడా సరే బోన్ మ్యారో నుండి బయటకు వస్తాయి. ఆర్బిసి, డబ్ల్యూబిసి, ప్లేట్లెట్స్, లింఫోసైట్స్, న్యాచురల్ కిల్లర్ సెల్స్, ఇమ్యూన్ సిస్టమ్ కావాల్సినవన్నీ, మళ్ళీ బాడీ యొక్క ఫంక్షన్ కావాల్సినవన్నీ, ఎవ్రీథింగ్ ఇస్ కమింగ్ ఫ్రమ్ బోన్ మ్యారో. ఓకే, సో బోన్ మ్యారో నుండి ఈ సెల్స్ వచ్చినప్పుడు we will see this in hematopoietic system మళ్ళీ. బట్ వన్ పాయింట్ ఇస్, బోన్ మ్యారోలో సెల్ ఏదైతే ఫామ్ అవుతుందో, ద బ్లడ్ సెల్ విచ్ ఇస్ ఫార్మ్, ఓన్లీ ఫస్ట్ వన్ సెల్ ఇస్ ఫార్మ్. నార్మల్ గా బోన్ మ్యారో లోపల there is only one cell which is formed. ఈ one cell which is formed, it is generally called as pluripotent stem cell అని అంటారు. ప్లూరిపోటెంట్ స్టెమ్ సెల్ అంటారు. ఈ ప్లూరిపోటెంట్ స్టెమ్ సెల్ నుండి ఆర్బిసి, డబ్ల్యూబిసి, ప్లేట్లెట్స్, లింఫోసైట్స్, ఎన్కే సెల్స్, ఇలా అన్ని డిఫరెంట్ టైప్స్ ఆఫ్ సెల్స్ ఆర్ కమింగ్. అందుకే ఎవరికైనా క్యాన్సర్ వచ్చింది అనుకోండి, ఇందాక మనం అన్నట్టు ఫర్ ఎగ్జాంపుల్ లింఫోసైటిక్ క్యాన్సర్ వచ్చిందండి, లింఫోమా వచ్చింది అనుకోండి, ఏమవుతుందంటే ఈ స్టెమ్ సెల్ ఫామ్ అవుతుంది బోన్ మ్యారోలో. ఈ స్టెమ్ సెల్ కంప్లీట్ గా ఓన్లీ లింఫోసైట్స్ ని తయారు చేస్తుంది ఇక్కడ. That bone marrow will have only lymphocytes and there is no production of RBC, WBC, platelets, natural killer cells. ఏవి ఉండవు. There's only lymphocytes that is being produced. That is called as lymphocytic leukemia. Okay, leukemia, blood cancer. ఆ బ్లడ్ క్యాన్సర్ మెజారిటీ ఆఫ్ ద టైమ్స్ ఎక్కడ క్యాన్సర్ అన్నది ఎక్కడ అవుతున్నది, ఇట్ ఇస్ హ్యాపెనింగ్ ఇన్సైడ్ ద బోన్ మ్యారో. దెర్ ఇస్ అ ప్రాబ్లమ్ ఇన్ బ్లడ్ సెల్ ప్రొడక్షన్. ఓకే, సో అటువంటప్పుడు ఎప్పుడైతే లుకీమియా అలాంటి ప్రాబ్లమ్స్ ఉందో, అటువంటి టైంలో ఏమవుతుందంటే స్టెమ్ సెల్ థెరపీ ఇస్తారు. ఓకే, బ్లడ్ క్యాన్సర్ కి స్టెమ్ సెల్ థెరపీ అనేసి ఇస్తారు. ఎందుకంటే దిస్ ఇస్ ప్లూరిపోటెంట్ స్టెమ్ సెల్. ఏం చేస్తారు తెలుసా? దే విల్ టేక్ ద పర్సన్స్ బోన్, ఒక పర్సన్ తీసుకొని అన్ని బోన్స్ లో ఎక్కడైతే బోన్ మ్యారో ఉందో కంప్లీట్ గా ఫస్ట్ డిస్ట్రాయ్ చేస్తారు. ఒక క్యాన్సర్ పేషెంట్ ఫస్ట్ దే విల్ అసెస్, అసలు ఆ పేషెంట్ తట్టుకోగలరా లేదా అనేది ఫస్ట్ అసెస్ చేస్తారు. ఒకవేళ ఆ పేషెంట్ తట్టుకోగలరంటే ఫస్ట్ ఏంటి, ఉన్న బోన్ మ్యారో అంతా డిస్ట్రాయ్ చేస్తారు. డిస్ట్రాయ్ చేసి ఒక హెల్దీ పేషెంట్ నుండి స్టెమ్ సెల్ ని కలెక్ట్ చేసి ఈ పేషెంట్ లోపల ఇంజెక్ట్ చేస్తారు, క్యాన్సర్ పేషెంట్ లో. ఎందుకు? అప్పటికైనా సరే ఈ స్టెమ్ సెల్ ఆర్బిసి, డబ్ల్యూబిసి, ప్లేట్లెట్స్, లింఫోసైట్స్, న్యాచురల్ కిల్లర్ సెల్స్ అండ్ ఆల్ ది అదర్ సెల్స్, ఇట్ విల్ స్టార్ట్ మ్యాక్రోఫేజెస్ ఎట్సెట్రా వీటినన్నిటిని కూడా ఈక్వల్ గా ఫార్మ్ చేస్తుంది అన్న ఒక హోప్ తో. యు అండర్స్టాండ్? యా, స్టెమ్ సెల్ థెరపీ ఇస్ దేర్ కదా, బ్లడ్ క్యాన్సర్ కి స్టెమ్ సెల్ థెరపీ ఇస్ దేర్. Allogeneic, autologous, there are different types of stem cell therapies. Okay, bone marrow transplant, that is also there. Yeah, Sagar, right? So bone marrow transplant can also be done in order to make sure that the patient's blood production, so cancer is treated. Enduku ante problem is in the bone marrow, ikkade edo jarugutundi, right? So formation of blood cells is happening in the bone marrow. Okay, yeah, Shramani, there are a lot of things there. Okay, there are layers in that. Okay, so all those matching, దాని తర్వాత after bone marrows, then you should ensure that there is no graft rejection. There are so many things in cancer treatment, but the point here is the blood cells are formed inside the bone marrow. One important point is RBC production ni erythropoiesis అంటాం. Erythropoiesis. ఈ erythropoiesis ని, whatever is causing this erythropoiesis is a hormone called as erythropoietin. Right? It is formed by erythropoietin. This erythropoietin is released by the kidneys. So ikkada point enti, evarkaina for example, if a person is suffering from, let us say, anemia, and you look at the patient and the patient has an anemia, hemoglobin count of 8, let us say 8.5, then what do? You give that patient iron supplements, and then you give that patient vitamin B12 and vitamin B9, hoping that it will take care of the anemia. And you ask the patient to come after 2 months. You are a doctor. 2 months tarvata the patient has come. you are looking at the CBP, complete blood picture. When you look at the CBP, suddenly you are finding that the hemoglobin levels have fallen further. 8 nundi, this time it has come to 7.5 or 7. Now what will you do? You will ask the patient, to go for an RFT. You will ask the patient to go for a renal function test. When the patient goes for the renal function test, you want to make sure that in the renal function test, the potassium levels and the creatinine levels are normal. If there is an abnormal potassium and creatinine levels, immediately you know that the patient has a chronic kidney disease. There is a kidney dysfunction. Kidney dysfunction valla there is no erythropoietin released. Because there is no erythropoietin released, there is no trigger in the bone marrow. Because there is no trigger in the bone marrow, no RBC and anemia is there for the patient as a consequence. So anduku, pluripotent is precursor Nagaraj. So anduku, iron injection ivanni fail ayina kuda kidney is a very important thing. So erythropoietin injection is there at one time. Okay, iron injection ichina labam ledhu. So they will give only erythropoietin injection because kidneys are not functioning. So erythropoiesis is triggered by the kidney. So every organ in the body has a link. What is bone importantly doing is the bone marrow blood cells are formed. Along with blood cells, forming blood cells, you will find macrophages, you will find fibroblasts, you will find adipocytes. Another important point, adipocytes. Adipocytes and fat storing cells. Okay. All these are found in bone marrow. Okay. All these are found inside bone marrow. Okay. This kind of a bone marrow, which is producing blood cells predominantly, is called as red bone marrow. Okay. ఏదైతే ఎక్కువ బ్లడ్ సెల్స్ ని ఫామ్ చేస్తాయో వాటిని మనం రెడ్ బోన్ మ్యారో అంటాం. బట్ as the age advances, as the age of a person, age of a human being advances, the adipocytes storage starts increasing in the bone. Okay. Adipocytes storage starts increasing in the bone. Because adipocyte storage starts increasing, it will start becoming a storage site for adipocytes and triglycerides. Okay, triglycerides, glyceryl triester. Okay, triglycerides. So it becomes a storage site for adipocytes and triglycerides. Triglycerides are the micromolecules for lipids. Okay, triglycerides will, glyceryl triesters have a glycerol backbone, forms an ester with fatty acids, and they will form lipids and fats. Okay, so micromolecules of lipids is triglycerides. So ఈ triglycerides stored అవ్వడానికి bone marrow will become a very important site. ఎప్పుడైతే adipocyte concentration ఎక్కువ అవుతుందో at that time what will happen is we call this bone marrow as yellow bone marrow. Okay, we call this as yellow bone marrow because of increased concentration of triglycerides. Okay, this is called as yellow bone marrow because of increased triglyceride storage. Okay, the red bone marrow tends to get converted into yellow bone marrow with age. Okay, so triglycerides will start getting deposited. Okay, it will start getting deposited and yellow bone marrow forms. So there are 6 functions of the bone marrow. One is the support, another one is to give protection, third one is for movements, fourth one is mineral coordination, okay, or mineral homeostasis, fifth one production of blood cells, okay, and sixth is storage of fats through yellow bone marrow. These are the 6 important functions of the skeletal system. ఎప్పుడైతే బాడీలో క్రైసిస్ వస్తుందో, ఆపద వస్తుంది, రైట్? ఆపద అంటే ఏంటి? ఫుడ్ లేకుండా పోయే కండిషన్, ఆర్ మీ పని ఫిజికల్ వర్క్ ఎక్కువైపోయి ఆహారం తక్కువైనప్పుడు, ఇన్ సచ్ కేసెస్ వాట్ విల్ హ్యాపెన్, బాడీ విల్ స్టార్ట్ యూటిలైజింగ్ ఫ్యాట్స్. సో ఫ్యాట్ యూటిలిటీ అన్నది అడిపోసైట్స్ ఫ్రమ్ ఫ్లెష్ అండ్ అదర్ రీజన్స్ నుండి ఫ్యాట్ కరిగి ఇట్ విల్ స్టార్ట్ గెటింగ్, lipids will start getting converted into glycogen, glycogen నుండి glycogenolysis, glycogenolysis నుండి గ్లూకోజ్, గ్లూకోజ్ మళ్ళీ ఎనర్జీ ప్రొడక్షన్ కి యూజ్ అవుతుంది. So fat perugutundi. So when fat is being used for energy, from the bones also this fat is being utilized. So it is a storage site. It is called as energy reserve. Yellow bone marrow is called as energy reserve. Okay, energy reserve through fat storage. Okay. So that is why the storage of adipocytes and yellow bone marrow is an energy reserve for the body. Okay. So there are 6 important functions of the skeletal system. Okay. The structure of the bone, the axial bones, and the appendicular. The axial bones are here, and the appendicular bones are here. Understand? Take this down. Take this down. Through adipocytes, energy reserve. Others note చేసుకున్నారా? Yeah. No, Saida. Look at it. Look at it as common bone marrow. Ivanni kuda bone marrow. Saida, all these are bone marrows. Bone marrow only. But the point is, the tendency of the bone marrow to store fat advances with age, and primarily the yellow bone marrow is nothing but a reserve site for triglycerides. Okay, so bone marrow, which is red, you can consider it to be the one which is more actively producing blood cells, and that part of the bone marrow which is storing the triglycerides is yellow bone marrow. Okay, look at it that way. Okay, where inside the bones only, Venugopal. Energy reserve. What is the energy reserve? These triglycerides are energy reserve. Okay, yellow bone marrow itself is energy reserve. Okay. Pluripotent Saujanya, pluripotent stem cell nundi all these things will come. Manaki hematopoietic system anesi there is a separate topic. We will see that in detail. Okay. You also have cancer in your syllabus. That also we'll have to see in detail. Okay. All right. Yeah, we will see. Don't worry. Saujanya, we will see. Okay. Um, yeah. Right. Okay. There are 31 pairs of spinal nerves, and we said there are basically more important is the 12 pairs of cranial nerves, which are important. Cranial nerves 3, 7, 9, 10 are part of the parasympathetic system. First of all, what you should remember is ఒక న్యూరాన్ నుండి ఇంకో న్యూరాన్ connection. Normally, you see this. A neuron has this structure. Okay. A neuron has this structure. Okay. ఒక neuron lo, what are the things which are present? You see this. ఒక సెల్ ఉందనుకోండి. వాట్ ఇస్ దేర్ మానస, వాట్ ఇస్ ప్రెసెంట్ ఇన్సైడ్ ద సెల్? ఇప్పుడు ఒక సెల్ తీసుకున్నామంటే what 80% of the cell is made up of what? It is filled with what, Farheen? Excellent. Cytoplasm, right? Excellent, Farheen. So it is made up of cytoplasm. Okay, so cytoplasm is predominantly present in the cell. The regions of the neurons, this is dendrites. Okay, these are dendrites. This is the cell body. This is the nucleus. This long tube is the axon. These are the terminals. Okay. The terminals of one neuron connect with the dendrites of another neuron. the terminals of one neuron connect with dendrites of another neuron. Okay. This is called as axon. These are called as terminals. Axon lopala. In fact, nerve inside the nerve, whatever the fluid that is present, okay, the fluid whichever is present inside is called as axoplasm. Okay, just like cytoplasm. Okay, it is called as axoplasm, just like cytoplasm. Understand? Just like cytoplasm, which is present inside every cell, there is axoplasm, which is present here. Okay. This axoplasm is covered by the layer which is called as axolemma. Axolemma. So, manaki cell membrane is also called as plasma lemma. Okay. Cell membrane is also covered with plasma lemma. Cell membrane is also called as plasma lemma. Similarly, the axonal membrane is also called as axolemma. Okay. It is called as axolemma. Okay. This is axolemma. When one neuron connects with another neuron, this connection is called as synapse. Okay. When one neuron connects with another neuron, the connection is called as a synapse. Okay. The connection is called as synapse. Okay. So this is called as synapse. Now, okay, neuron. Okay, when there is a connection between one neuron and another neuron, we are calling it as a synapse. Now, this is one neuron and this is another neuron. But instead of just one neuron, if you have collection of mini neurons from one side, such a collection of mini neurons is actually called as a nerve. Manam nerve annadi oka neuron ka. Collection of neurons is called as a nerve. Okay. The neuron which is present before the synapse, okay, the neuron which is present before the synapse is called as presynaptic neuron. Okay. The neuron which is present after the synapse is called as postsynaptic neuron. Okay. When there are many neurons collected together, we are calling it as a nerve. Okay. When a nerve is present and when there is a collection of nerves, okay, nerve okate kakunda, when there is a collection of nerve, jabin, synapse, whatever is present before the synapse is presynaptic. Whatever is coming after the synapse is called as postsynaptic. Most of the times neurons are connected like this. The terminal of one neuron is connected to the dendrites of another neuron. Okay. When there is a collection of nerves, okay, or you can say even there's a collection of neurons. When they are collected like this, what happens is the cell bodies of all those neurons come together. Okay. When they are in collection, when there are many hundreds of neurons are coming together, a cell bodies anni oka chota untayi. That collection of cell bodies from where many neurons come out. See, neurons ante, many axons come out. Okay, neuron ante, there is a cell body and axon is coming out. When there is a collection of this particular neurons, okay, where the cell bodies of these neurons are together and the axons are coming out in one direction or many direction, that collection of cell bodies, okay, collection of cell bodies in the CNS is called as nucleus. Okay. The collection of cell bodies inside the CNS is called as nucleus. The collection of cell bodies in the peripheral nervous system is called as a ganglion. This is an important point. The collection of cell bodies present inside the central nervous system is called as a nucleus. And inside the brain and spinal cord. But outside the brain and spinal cord, if there is a collection of cell bodies occurring, then that is called as a ganglion. మనం ఇక్కడ we are simply representing one neuron and another neuron, one presynaptic neuron and one postsynaptic neuron. అందువల్ల we are saying this is a presynaptic neuron, this is a synapse, this is a postsynaptic neuron. But if you are representing a bunch of neurons, okay, or nerves, that time you will not take the reference of synapse. Some textbooks may call the nerves which are present before are called as preganglionic అనేసి అంటారు కొన్నిసార్లు. Preganglionic, and what is coming after a ganglion is postganglionic అనేసి అంటారు. Postganglion. ఎందుకంటే we are talking about hundreds of nerves like this, hundreds of nerves coming out in different directions. Okay, like this, they are going in different directions, and all their cell bodies are together, which you are calling it as a ganglion, because if it is part of the peripheral nervous system. So whatever is the set of nerves which are before this ganglion is called as preganglionic, and whatever is happening after is called as postganglionic. Okay. And for our understanding, it is important that we remember presynaptic, postsynaptic. Okay, collection of cell bodies is called as ganglion. Is that clear? Is this clear? Presynaptic, postsynaptic, preganglionic, postganglion. Okay. So ganglion ke mundu unte, when there is a collection, okay, when there is a bunch of neurons, the cell bodies, when they are together, we are calling it as ganglion. Ganglion mundunna nerve anta kuda preganglionic nerves and or preganglionic neurons, and there are many. And whatever is after the ganglion is obviously which are part of the ganglion going in different directions. We are calling it as postganglionic. But when we are representing a single connection between one neuron and another neuron, we are simply calling it as presynaptic and post. Okay. Now you see this. The peripheral nervous system. Okay. The peripheral nervous system has three branches. We saw yesterday. Okay. We saw three branches. What is the PNS? What are the three branches of PNS? PNS is made up of the nervous system, basically consists of central nervous system and peripheral nervous system. Central nervous system is brain and spinal cord. All the nerves which are coming out of brain and spinal cord are called as peripheral nervous system. This peripheral nervous system is divided into three. Okay, what are those? Simply for peripheral nervous system, you have, you simply have somatic, you have autonomic, somatic, autonomic, and sensory. ఈ sensory అన్నవి, the sensory is actually, it is part of autonomic and it is part of somatic. Okay, if the sensory nerves are part of somatic, okay, Saida, we'll see that. See, nervous system is divided into two, CNS and PNS. CNS is nothing but brain and spinal cord. All the nerves which are coming out from brain and spinal cord is part of your PNS, that is peripheral nervous system. Peripheral nervous system is divided into three parts: somatic, autonomic, and sensory. Sensory are the ones which are bringing the sensory signals to the brain from organ. So somatic is voluntary nerves which helps in voluntary movement, and of course autonomic or involuntary, you have no control on this. Okay, involuntary is autonomic nervous system. Now the sensory nervous system is part of both autonomic and somatic. The sensory nervous system, which is part of somatic nervous system, is called as somatosensory. And that which is part of autonomic nervous system is called as visceral sensory. That is why we are calling sensory nervous system as mixed. Sometimes it is part of somatic, sometimes it is part of autonomic. If it is part of autonomic, it is visceral sensory. If it is part of somatic system, it is somatosensory. Okay. So the peripheral nervous system is divided into three: somatic, which deals with voluntary movements, where I am able to move my head or my hands. Okay, all these are voluntary movements, somatic nervous system. And autonomic nervous system, involuntary, ante my heartbeat, for example. Okay, or my movement in the intestine. It's not in my hands. Okay, so all those are autonomic, involuntary. And then there are sensory, ante sensations are being brought where voluntarily I go and touch a wire, I feel a shock, I pull my hand. That is somatosensory. But there is also visceral sensory, which is autonomic. You will have pain in your stomach. You will feel uneasy in your stomach, for example. Okay, you are not having any control, but you are getting a sensation that there is a pain in the stomach. So that kind of visceral sensory part of the autonomic, it's part of the autonomic system where you have no control. But when you have control, when you're able to touch things, that is called as somatosensory. That is why sensory has different types of nerves. Okay. So the sensory nerves which are part of somatic system are called as somatosensory. That which is part of the autonomic nervous system is called as visceral sensory. Okay. So the peripheral nervous system is divided into somatic, autonomic, and sensory. This autonomic nervous system, okay, this autonomic nervous system is further divided into three. It is divided into enteric, sympathetic, and parasympathetic. Okay. Enteric is in the intestines, okay, where the nervous system is kind of showing an independent function. But you have sympathetic and parasympathetic system. All these three together forms the autonomic nervous system. Autonomic, sensory, somatic nervous system forms the peripheral nervous system. The brain and spinal cord nerves are the peripheral nervous system. Brain and spinal cord themselves are part of the central nervous system. Is that clear? Saida, is it clear? Others? Shruti? Yeah? Okay. Now you see this. In our syllabus, what we have is autonomic nervous system. That too, in that we have sympathetic and parasympathetic. That's what is expected from us to learn a little bit more in detail. Okay. So now you see this. All of the autonomic nervous system, okay, they have a two neuron connection. Okay. All the autonomic nervous system, they have a two neuron connection. Okay. They have this kind of a two neuron connection. Okay. A presynaptic neuron and a postsynaptic neuron. Okay. If 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 the presynaptic okay, the presynaptic neuron generally is coming from the presynaptic neuron is generally coming from the brain. Okay, it is bringing signal, and that signal is being passed into this another neuron, and this neuron is passing into another organ. Let us say it is passing to the heart to show some kind of a function. The presynaptic neuron is connected to the brain, and from brain it is moving down. There is another synapse, and from there another axon is going, and it is reaching the effector organ. Okay. The signal that is being conducted, generally there is a term which is called as signal transduction. This is normally used for cellular level processes, signal transduction. Some authors also use it for nerve conduction, signal transduction or nerve conduction. Okay. This nerve conduction happens because of two ways. Okay. Nerve conduction happens in two ways. One, the nerve conduction happens because of passage of electricity or electricity changes. One is through a difference in the electricity. Okay. Whenever there is an electricity change or there is a passage of current, we are calling it as action potential. Okay. The change in electricity is one through which there is a communication that happens from one neuron to another neuron. Let us say, for example, you start running. Your voluntary action is to move your legs and you keep running. As you keep running, what happens? There are signals that are sent to the brain. And now the brain will have to send signal through, let us say, the sympathetic system, okay, to increase the heart rate. Okay, or it sends to the spinal cord, and from spinal cord, the signals are coming and it is increasing the heart rate. Okay. So the increase in heart rate is happening because of the sympathetic system. I'm just giving an example, but you are running. So how does the brain or spinal cord CNS communicate this signal? It is going to communicate through action potential. So there are two things. One is signal communication happens through two things. One is the electricity, that is action potential. And the second one is through chemicals. This is called as neurotransmission. Potential. Another one is called as neurotransmission. Two processes help in the neuronal signal conduction, neuronal communication. Okay. The cells of the nervous system, they release the chemicals from the terminals. From the terminals, they release some chemicals. The chemicals which are released from the terminals are called as neurotransmitters. ఈ neurotransmitters ఉన్నది కాబట్టి we are calling it as neurotransmission. Okay. So there are neurotransmitters which are released by the terminals. Okay. The electric conduction is happening because of action potential. When the neurotransmitters are released, ఇవేంటివి neurotransmitters అన్నవి chemical. In the post-synaptic neuron, you should have something to receive these chemicals. There is a requirement of proteins which will take up these chemicals, and these proteins are present on the surface of this neuron which will be able to take up these proteins. These proteins are called as receiving proteins, otherwise called as receptors. Okay. They are called as receiving proteins or they are called as receptors. Similarly, when the postsynaptic neuron releases chemicals, the organ, be it heart or any other lung or any other organ, they also need to have a receptor or a receiving protein in order to take this chemical entity for the neurotransmission to become successful. So the neurotransmission is happening through chemicals. The action potential is through the electrical impulses, changes in the electric potential of the neurons. Take this down and let me know. Just take this down, take a snapshot of this. So for him, um, we have to complete a lot of syllabus. You will have access to repeat class, right? So you can just listen to that once. I mean, you have to excuse me. So the the receptors are receiving proteins which will take in these neurotransmitters. Okay. So once the chemicals are released, they will go and bind to these receptors, right? And then here there is there is heart which will have, let us say for example, there is heart and there is a receptors here and the chemicals are released from it which is going to take. Okay. Have you taken this down? Yeah. So now you see this in the autonomic nervous system. In the autonomic nervous system, the two types of, I mean, it is further divided into two major types that we are interested in. One is called as the sympathetic nervous system. The other one is called as parasympathetic nervous system. Okay. Both sympathetic and parasympathetic nervous system, both of these have a two neuron arrangement. Okay. There is one neuron here, another neuron here. This kind of an arrangement is present in both. So, రెండిట్లోనూ ఇలా ఉన్నప్పుడు what you have to remember is the neurotransmitter which is released by the presynapse. So first let us look at the sympathetic system. In the sympathetic system, the presynaptic, so there is a neurotransmitter which is released by the presynaptic neuron. The neurotransmitter which is released by the presynaptic neuron in the sympathetic system is acetylcholine. Okay. Once this is released, it goes and interacts with this receptor, and this acetylcholine activates the postsynaptic neuron. The postsynaptic neuron will again conduct electrical impulse, and the postsynaptic neuron will also release chemical moieties. Okay. Chemical moieties are released by the presynaptic neuron. The presynaptic chemical or the neurotransmitter which is released is acetylcholine. It interacts with the receptor. There is a passing of the signal in the form of action potential. And this particular action potential will pass on, and finally, it will help in the release of again neurotransmitter. This is called as the postsynaptic neurotransmitter. The postsynaptic neurotransmitter of sympathetic system is noradrenaline. Okay, noradrenaline. The presynaptic neurotransmitter is acetylcholine. The postsynaptic neurotransmitter is noradrenaline. Okay, in sympathetic system. Okay, in sympathetic system, the presynaptic neurotransmitter is acetylcholine. Postsynaptic neurotransmitter is noradrenaline. In parasympathetic system, the presynaptic neurotransmitter is again acetylcholine only here also. Okay. The presynaptic neurotransmitter in parasympathetic system is also acetylcholine. The postsynaptic neurotransmitter in parasympathetic system is again acetylcholine. You understand? The presynaptic neurotransmitter is acetylcholine in both the cases. In case of parasympathetic system, in case of sympathetic system, the presynaptic neurotransmitter is acetylcholine and the postsynaptic neurotransmitter is also acetylcholine in case of parasympathetic system. In case of sympathetic system, the presynaptic neurotransmitter is acetylcholine, postsynaptic neurotransmitter is noradrenaline. Okay, take this down. No, Shruti. Presynaptic neurotransmitter is acetylcholine. Okay. Presynaptic neurotransmitter is acetylcholine for both. Okay. Postsynaptic neurotransmitter for parasympathetic system, it is acetylcholine. For sympathetic system, it is noradrenaline. Yeah, okay, Manasa, correct. In parasympathetic system, the presynaptic neurotransmitter and postsynaptic neurotransmitter both are acetylcholine. Correct. Pavani, I have no notes with me. Okay. No, so you will have to, that is why recording classes is given, right? Yeah, we will come to receptors. We have not come there, Chandrasekhar. ఇంకా అక్కడికి రాలేదు మనం. We'll come there. మీరు ముందెళ్ళిపోతున్నారు. So is this clear? Presynaptic neurotransmitter is acetylcholine for both sympathetic and parasympathetic system. Postsynaptic neurotransmitter is acetylcholine for parasympathetic system and noradrenaline for the sympathetic system. Okay. Now, you see this. You see these two scenarios. There is a neuron. Okay. In this neuron, there are few things which are happening. Okay. Inside this neuron, the inside part of neuron has a membrane potential of minus 70 millivolts. Okay, lopala the membrane potential, resting membrane potential antunam. Ante electric potential of this neuron, okay, resting membrane potential of this neuron is minus 70 millivolts. Okay. The minus 70 millivolts, let us say this is a presynaptic neuron. The presynaptic neuron యొక్క resting membrane potential is minus 70 millivolts. Whenever there is a signal that is coming from the central nervous system, or if it is a postsynaptic neuron, a signal is coming from the presynaptic neuron, whichever way. If there is a signal which is coming to this, okay, presynaptic neuron ko signal వచ్చి, if this signal is being communicated to this neuron, what will happen first is that sodium channels from the surroundings, the sodium from the surroundings through the sodium channel will come inside the neuron. Okay. When the sodium comes inside the neuron, the positive charge will start contributing to the membrane potential of this. So minus 70 millivolts nundi minus 40, minus 10 and 0 millivolts because of this positive charge. Lopala, yeah, from the extracellular fluid. Inside there is minus 70 millivolts, negative charge. ఈ నెగటివ్ చార్జ్ ఈ పాజిటివ్ అయాన్ లోపలికి వస్తున్నందువల్ల ఈ క్యాటయాన్ లోపల వస్తున్నందువల్ల ఈ నెగటివ్ చార్జ్ అనేది స్లోగా టువర్డ్స్ జీరో అవుతుంది ఒక చోట. ఈ 70 minus 70 ఉన్నప్పుడు దెర్ వాజ్ అ పొలారిటీ. ఓకే, దెర్ వాజ్ అ పొలారిటీ అంటే లోపల minus 70 బయట ప్లస్ 70. ఓకే, లోపల minus 10 బయట ప్లస్ 10. కానీ జీరో వచ్చినప్పుడు దెర్ ఇస్ నో పొలారిటీ. జీరో అనేది న్యూట్రల్. ఓకే, Because their zero is neutral, whenever there is zero, we call it as a depolarized state. You understand? This is called as depolarized state. So zero vachinappudu, it is called as depolarized state. Whenever any neuronal cell, okay, when any neuronal cell is depolarized, then it is activated. Okay, అంటే దాని ఫంక్షన్ చూపించడానికి any nerve or neuron should get into depolarization state. What depolarization అవుతున్నది? Because of sodium. Very good. Because of sodium, depolarization అవుతున్నది. Sodium influx, భావన, very good. Very, very good. Influx of sodium. Sodium అన్నది లోపలికి వస్తున్నది న్యూరాన్ లోపల. So there is influx of sodium, because of which there is depolarization. ఎప్పుడైతే ఈ సెల్ డీపోలరైజేషన్ అటైన్ అవుతుందో అప్పుడు ఇక్కడ కాల్షియం అన్నది సెల్ లోపల ఎంటర్ అవుతుంది. ఇట్స్ వెరీ ఇంపార్టెంట్ పాయింట్. ఎప్పుడైతే డీపోలరైజేషన్ అవుతుందో అప్పుడు కాల్షియం అన్నది లోపల ఎంటర్ అవుతుంది. ఓకే, కాల్షియం అన్నది లోపల ఎంటర్ అవుతుంది. ఎప్పుడైతే సెల్లో డీపోలరైజ్ స్టేట్ అవుతుంది. ఓకే, ఇప్పుడు ఒకసారి మీరు ఇక్కడ చూడండి. ఈ కాల్షియం లోపల ఎంటర్ అయిన తర్వాత మనకి సెల్ లోపల వాట్ ఈస్ ద థింగ్ దట్ ఈస్ హ్యాపెనింగ్ ఇన్సైడ్ ద సెల్? ఓకే, ఇన్సైడ్ ది నర్వ్ సెల్ what is it that is happening when it is depolarized? Okay, now you see this. Let me take this terminal. ఈ టెర్మినల్ నుండి acetylcholine or noradrenaline release అవుతున్నది అంటున్నాం కదా. Let us say, for example, I am taking an example of this huge terminal. This terminal, let us say, it is part of the this is presynaptic neuron. ఈ presynaptic neuron, let us say, for example, this is parasympathetic system. A parasympathetic neuron అనుకుందాం. పారాసింపాథెటిక్ సిస్టమ్ లో ప్రీసినాప్టిక్ న్యూరాన్ యొక్క న్యూరో ట్రాన్స్మిటర్ ఏంటిది? వాట్ ఈస్ ద న్యూరో ట్రాన్స్మిటర్ ఆఫ్ ద ప్రీసినాప్టిక్ న్యూరాన్ ఆఫ్ పారాసింపాథెటిక్ సిస్టమ్? acetylcholine. Rajesh, very good. Okay, very simple. It is acetylcholine. Okay, so this is acetylcholine, right? So now what exactly happens here? You just see this. Okay, you just see this. What exactly happens here? You కొంచెం మీరు ఫోకస్ చేయాలి. Okay, don't get distracted. You see this. What exactly happens inside this particular neuron? You see, ఈ axon లోపు, okay, whichever is the axon which is before, ఈ axon, entire axon లోపల నార్మల్ గా ఏమవుతుందంటే axon లోపలికి కోలిన్ అన్న ఒక కెమికల్ విల్ బి ట్రాన్స్పోర్టెడ్. కోలిన్ ఎక్కడుంది? కోలిన్ ఇస్ ప్రెసెంట్ ఇన్ ఎక్స్ట్రా సెల్యులార్ ఫ్లూయిడ్. ఇట్ ఇస్ ప్రెసెంట్ ఇన్ ద బ్లడ్. ఓకే, అండ్ ఇట్ ఇస్ ఆల్సో ప్రెసెంట్ ఇన్ membranes. ఓకే, సో కోలిన్ అన్నది లోపలికి వెళ్తుంది. కోలిన్ ఇస్ నథింగ్ బట్ CH3, CH3, CH3 plus charge, CH2, CH2, OH. This is the structure of choline. Choline is NNN trimethyl ethanolamine. Okay, take this down. Choline is NNN trimethyl ethanolamine. CH3, CH3, CH3 on this nitrogen. NNN trimethyl ethanolamine. సో ఈ కోలిన్ ఎప్పుడైతే లోపలికి వస్తుందో ఇన్సైడ్ దిస్ axon, ఇన్సైడ్ ది axon there is an enzyme which is present. ఒక ఎంజైమ్ ఉంటుంది ఇక్కడ. దట్ ఎంజైమ్ ఏదైతే లోపలికి వస్తుందో, ఓకే, ఒకటే నైట్రోజన్ మానస్ సార్. ఓకే, సో ఇక్కడ దిస్ పర్టికులర్ axon has an enzyme. దిస్ ఎంజైమ్ ఇక్కడికి రాస్తున్నాను. ది నేమ్ ఆఫ్ దట్ ఎంజైమ్ ఇస్ choline acetyl transferase. It is called as CAT, choline acetyl transferase. Okay, choline acetyl transferase, which is called as CAT. ఈ క్యాట్ ఎంజైమ్ ఏం చేస్తుందంటే ఈ కోలిన్ ఏదైతే లోపలికి వచ్చిందో ఇట్ విల్ కంబైన్ దిస్ కోలిన్ విత్ అసిటైల్ కోఏ. ఓకే, దిస్ ఇస్ కాల్డ్ యాజ్ అసిటైల్ కోఏ. ఈ కోలిన్ and this acetyl CoA, they combine together. Okay, this is acetyl CoA is an acid, choline is an alcohol. When acid and alcohol combines, you will get what is called as an ester. Like ester వస్తుంది ఇక్కడ. So what you will get is CH3, nitrogen, CH3, CH3 plus charge, CH2, CH2, O, C double bond O, CH3. This is nothing but acetylcholine. Acetyl-CoA and choline will combine together to form acetylcholine. Okay, this is an ester bond. The alcohol and an acid will form an ester. What is this? Okay, the alcohol. So this is the ester bond here. Okay, the alcohol and acid will form the ester. Okay, this is the ester bond. This is the structure of acetylcholine. E acetylcholine is formed in the presence of choline acetyl transferase. Okay, when choline from the blood goes inside the neuron, there is an enzyme called as choline acetyl transferase. A neuron lopale acetyl CoA kuda undi. So this acetyl CoA plus choline will form acetylcholine inside the neuron in the presence of the enzyme choline acetyl transferase. This acetylcholine, which is formed inside the neuron, this is transported into a lot of bag-like structures inside this terminal. Okay, terminal లోపల బలూన్ లాగా ఒక బ్యాగ్ లాంటి స్ట్రక్చర్స్ లోపల ఈ అసిటైల్ కోలిన్ అన్నది దీని లోపలికి స్టోర్ అయి ఉంటాయి. ఓకే, సో దిస్ విల్ గెట్ స్టోర్డ్ ఇన్సైడ్ దిస్ బ్యాగ్ లైక్ స్ట్రక్చర్ ఇన్సైడ్ ద న్యూరాన్. ఓకే, సో ఈచ్ ఆఫ్ దీస్ బ్యాగ్ విల్ హ్యావ్ అసిటైల్ కోలిన్. ఓకే, ఈచ్ ఆఫ్ దీస్ బ్యాగ్ లైక్ స్ట్రక్చర్స్ will have this acetylcholine stored. This acetylcholine, which is stored inside this bag-like structures, okay, will be present inside the terminal of the neuron. ఈ బ్యాగ్ లైక్ స్ట్రక్చర్ ని మనం ఏమంటున్నామంటే వీటిని మనం వెసైకల్స్ అని అంటున్నాం. ఓకే, దీస్ ఆర్ కాల్డ్ యాజ్ వెసైకల్స్. ఓకే, దీస్ ఆర్ కాల్డ్ యాజ్ వెసైకల్స్. ఓకే వైశాలి, దీస్ ఆర్ కాల్డ్ యాజ్ వెసైకల్స్. ఈ వెసైకల్స్ లోపల వాట్ ఇస్ ప్రెసెంట్ మానస? What is present inside these vesicles? Acetylcholine, Neelima. Very good. No. What is present? Acetylcholine is present inside this bag-like structure. Okay. What is helping to form acetylcholine? Sumalata, what is helping to form acetylcholine? Choline acetyl transferase. That's it. Okay, the enzyme choline acetyl transferase, CAT. Okay, choline acetyl transferase is helping to form this. Okay, now ఈ న్యూరాన్ టెర్మినల్ లో ఈ అసిటైల్ కోలిన్ అన్నది ఈ సంచిల్లో, ఓకే, దిస్ వెసైకల్స్ ఇట్ ఇస్ స్టోర్డ్. నౌ వాట్ హ్యాపెన్స్ ఇఫ్ యు కమ్ బ్యాక్ హియర్, ఒక సిగ్నల్ వచ్చినప్పుడు ఫస్ట్ ఏమవుతున్నది, రెస్టింగ్ మెంబ్రెయిన్ పొటెన్షియల్ -70 మిల్లీవోల్ట్స్ లో ఉంటున్నది. ఆ -70 మిల్లీవోల్ట్స్ లో ఉన్నప్పుడు ఒక సిగ్నల్ రాగానే సోడియం అన్నది లోపల ఇన్ఫ్లక్స్ అవుతుంది. వెనెవర్ సోడియం ఇన్ఫ్లక్స్ టేక్స్ ప్లేస్, అలాగా మెంబ్రెయిన్ పొటెన్షియల్ -70 నుండి 0కి వస్తున్నది, విచ్ ఇస్ కాల్డ్ యాజ్ డీపోలరైజ్డ్ స్టేట్. ఈ డీపోలరైజ్డ్ స్టేట్ వచ్చినప్పుడు కాల్షియం అన్నది లోపలికి వస్తుందండి. ఆ కాల్షియం ఏదైతే లోపలికి వస్తుందో, దట్ కాల్షియం కమ్స్ ఇన్ టు ద టర్మినల్. యు సీ దిస్, ఈ కాల్షియం అన్నది ఈ టర్మినల్ లోకి వచ్చింది. దేని వల్ల వచ్చింది కాల్షియం లోపల? ఆ న్యూరాన్ డీపోలరైజేషన్ లోకి వెళ్ళినందువల్ల వచ్చింది. ఆ న్యూరాన్ డీపోలరైజేషన్ లో ఎందుకు వెళ్ళింది? ఎందుకంటే సోడియం ఇన్ఫ్లక్స్ అయింది కాబట్టి. సోడియం ఇన్ఫ్లక్స్ ఎలా అయింది? ఆ నర్వ్ యాక్టివేట్ అయింది కాబట్టి, బికాస్ ఆఫ్ ద సిగ్నల్ ఫ్రమ్ ద బ్రెయిన్ ఆర్ స్పైనల్ కార్డ్. You understand? And that is activated because it is going into depolarization, right? Now this calcium has entered into the neuron. Now you know what this calcium will do? This calcium will tear open these vesicles. ఈ కాల్షియం లోపల రాగానే ఆ వెసైకల్స్ ని కంప్లీట్ గా చింపేస్తుంది. Okay, it will just tear open this. Once the vesicles are torn, what will happen? If the vesicles are torn, Hafsa, what will happen when the vesicles are torn? Sumanjali, what is going to happen? Yeah, ACH will come out. All this ACH will get released. Acetylcholine will get released out. You understand? మనం ఏమన్నాం అక్కడ? ప్రీ సినాప్టిక్ న్యూరో ట్రాన్స్మిటర్ నుండి పోస్ట్ సినాప్టిక్ న్యూరో ట్రాన్స్మిటర్ కి కమ్యూనికేషన్ అవ్వాలంటే, if there has to be a communication, two processes are involved. One is electric impulses. Okay. One is through the electricity. Another one is through the release of neurotransmitter. Both are linked. So the electric part of it is because of the depolarization through the influx of sodium ions. Membrane potential millivolts, -70 millivolts నుంచి చేంజ్ అయ్యి depolarized state కు వస్తుంది. Once it hits the depolarized state, calcium influx అయ్యి, calcium will come into the neuron, tear open the vesicles and release the neurotransmitters out. You understand? So neurotransmission and depolarization or action potential. ఈ -70 నుండి ఈ 0కి వస్తున్నది కదా మెంబ్రెయిన్ పొటెన్షియల్. ఈ కన్వర్జన్, ఈ ఎలక్ట్రిసిటీ చేంజ్ నే మనం యాక్షన్ పొటెన్షియల్ అనేసి చెప్తున్నాం. అండర్స్టాండ్? వన్ ఇస్ ది యాక్షన్ పొటెన్షియల్, అనదర్ వన్ ఇస్ ది neurotransmitter release or neurotransmission. Two processes are involved in signal transduction. ఓకే, ఒక సెల్ నుండి ఇంకో సెల్, ఒక న్యూరాన్ నుండి ఇంకో న్యూరాన్ కి కమ్యూనికేట్ అవ్వాలంటే యాక్షన్ ముందున్న న్యూరాన్ నుంచి ఒక 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 సిగ్నల్ లోపలికి రావాలి. అండ్ ఫ్రమ్ దేర్ అనదర్ సిగ్నల్ హ్యాస్ టు గో దేర్. ఫ్రమ్ వేర్ విల్ ఇట్ కమ్, మహేష్? టెల్ మీ ఫ్రమ్ వేర్ విల్ దిస్ choline come? From where will this calcium come? From where will this sodium come? No. Ikkada, for the neuron, from where will it come into the neuron? From blood. Extracellular fluid, from blood it is coming. That's it. They are present in the blood. Continuously, all these ions are present in the blood. Okay, blood, extracellular fluid, and enter into the neuron. That's it. Is this clear? So you have seen what is action potential and neurotransmission. Okay. Now you see one more point we will see. ఈ రిసెప్టార్ ఏదైతే ఉందో, that receptor that we were seeing, the receptor is called as a receiving protein. Okay, let us say for example, heart తీసుకున్నాం. There are receptors. These receptors are called as receiving proteins. Okay, these receptors are called as receiving proteins. Now let us say from a postsynaptic neuron, from a postsynaptic neuron, okay, from the postsynaptic neuron, okay, now what is happening is there is a release of this neurotransmitter. సో ఈ న్యూరో ట్రాన్స్మిటర్ రిలీజ్ అయినప్పుడు there are some receptors. These are receiving proteins. Okay. ఈ receiving proteins which are present, they are unique to sympathetic and parasympathetic system. Okay. They are unique to sympathetic and parasympathetic system. The receptors which are part of the sympathetic system, the receptors which are part of the sympathetic system are alpha and beta receptors. You have alpha 1, alpha 2, you have beta 1, beta 2, beta 3. Okay. The receptors of parasympathetic system are muscarinic and nicotinic. Okay. M means muscarinic. N ante nicotinic. ఈ muscarinic receptors are M1, M2, M3, M4, M5. Okay. There are 5 muscarinic receptors, M1, M2, M3, M4, M5. The nicotinic receptors are NM and NN. Okay. NM ante nicotinic muscular. NN ante nicotinic neuronal. Okay. NN ante nicotinic neuronal, NM ante nicotinic muscular. Okay. The postsynaptic neurotransmitter for sympathetic system is noradrenaline. Okay. The postsynaptic neurotransmitter for sympathetic system is noradrenaline. Okay. Noradrenaline, norepinephrine. The postsynaptic neurotransmitter for parasympathetic system is acetylcholine. Okay. ఈ postsynaptic neurotransmitter for sympathetic system noradrenaline కాబట్టి sympathetic system is also called as adrenergic system. Okay. This is also called as thoracolumbar outflow. మనం ఆల్రెడీ చూసాం ఇది anatomy పరంగా it is called as thoracolumbar outflow. Neurotransmission పరంగా it is called as adrenergic system. General గా autonomic nervous system paranga it is called as sympathetic system. Anni okate. Okay. Because the postsynaptic neurotransmitter is acetylcholine, parasympathetic system is also called as cholinergic system. Anatomy paranga this is called as craniosacral outflow. And autonomic nervous system paranga it is called as parasympathetic system. Okay, take this down. Yeah, because Saida, the postsynaptic, see what differentiates your parasympathetic system and the sympathetic system. What is differentiating it? There are two things which are main differentiators. One is the receptors, another one is the postsynaptic neurotransmitter. Because the presynaptic neurotransmitter for your sympathetic and parasympathetic system, it is common. It is the same. It is acetylcholine. So you will not be able to differentiate the sympathetic and the parasympathetic system based on the presynaptic neuron. You will only be able to differentiate the parasympathetic and sympathetic system based on neurotransmission of the postsynaptic neuron, right? Because the postsynaptic neurotransmitter for the sympathetic system is noradrenaline, it is called as adrenergic system. And similarly, postsynaptic neurotransmitter for parasympathetic system is acetylcholine. Hence, you are calling it as cholinergic system. And from an anatomical perspective, the nerves which are supplying these sympathetic innervations are generally considered to be thoracolumbar in nature, right? From thoracolumbar spinal nerves, most of these are coming out. And for cholinergic receptors, the supply is coming from the craniosacral outflow, cranial nerve 3. So basically, for other parts of the body, it is only the vagus nerve. But within the eye and within the other regions, it is cranial nerve 3, cranial nerve 7, cranial nerve 9, cranial nerve 10. Right? Cranial nerve 3 is oculomotor, cranial nerve 7 is facial, cranial nerve 9 is glossopharyngeal, cranial nerve 10 is vagus. So all these four nerves are innervating different regions of the body, and they are supplying the cholinergic innervation to different parts of the body, showing cholinergic activity. So that is the fundamental difference. Hence, sympathetic system, or when you call it as adrenergic system, or you call it as a thoracolumbar system, it's the same. And similarly, you call it as a parasympathetic system or cholinergic system or craniosacral outflow, it is the same. The receptors which are part of the adrenergic system are alpha beta receptors. The receptors which are part of parasympathetic system are called as muscarinic and nicotinic receptors. Okay. Is that clear, all of you? Yeah. Yeah. Now you see this. Let us say, these are, okay, so these are these receptors which are present here. Let us say these are cholinergic receptors. Okay, these are cholinergic receptors. And from this neuron, what is happening? After entry of calcium, there is neurotransmission. There is a release of acetylcholine that is happening. Acetylcholine is releasing. Once the acetylcholine is released, it is not that all the acetylcholine which is released is going to go and interact with the receptors. This is not going to happen. Some acetylcholine moieties will interact with the receptors. Remaining acetylcholine moieties, which are present here, which are released, will get destroyed. They get destroyed. They get destroyed by an enzyme called as acetylcholine esterase. There is an enzyme called as acetylcholine esterase. This acetylcholine esterase destroys acetylcholine, breaks acetylcholine in order to once again form choline and acetyl-CoA. Okay, choline and acetyl-CoA. How did acetylcholine form? Acetylcholine formed from choline and acetyl-CoA in the presence of choline acetyl transferase. What happened to acetylcholine? Acetylcholine once again broke back into choline and acetyl-CoA in the presence of acetylcholinesterase. Okay. In the body, there are two enzymes. Okay. In the body, there are two important enzymes which can break esters. Okay. Which can break esters. One is acetylcholine esterase. Another one is called as butyrylcholine esterase. Butyrylcholine esterase. Both can break acetylcholine, but butyrylcholine esterase can break other esters also. Okay, so this is BUCH, butyrylcholine esterase. This is acetylcholine esterase, ACH. Acetylcholine esterase is only specific for acetylcholine, whereas butyrylcholine esterase can break any ester within the body. Is that clear? Okay. Whenever acetylcholine binds to its receptor, that binding of this receptor will send some signals within this organ. It will send some signal within this organ and it will show some activity. The activity it shows is called as intrinsic activity. It shows intrinsic activity. Okay. So acetylcholine, okay, acetylcholine is called as an endogenous agonist. Agonist. Agonist ante enti? Agonist is something which has an affinity to the receptor and it shows an intrinsic activity. Affinity ante attraction. It has attraction to the receptor and it also shows some activity inside. That is called as an agonist. So acetylcholine receptors agonist enti? Acetylcholine itself is the endogenous agonist. You understand? Once agonist, that is acetylcholine, binds to this receptor, acetylcholine will show signal inside and it will pass on the signal and show some activity. That activity is called as intrinsic activity. That activity is called as intrinsic activity. Affinity plus intrinsic activity. That is shown by agonist. Okay. బాడీలో న్యాచురల్ గా ఉన్న కెమికల్ ఒకవేళ ఇలాంటి అగోనిస్టిక్ యాక్టివిటీ చూపించిందంటే దాన్ని ఎండోజినస్ అగోనిస్ట్ అంటాం. ఎండోజినస్ అగోనిస్ట్ అంటే ఏంటి? బాడీ లోపలే ఇవి తయారవుతున్నాయి అగోనిస్ట్. కానీ మీరు డ్రగ్స్ తీసుకొని వేరే ఏదో కొంచెం డిఫరెంట్ కెమికల్ స్ట్రక్చర్ ఉంటూ కానీ మళ్ళీ ఇదే రిసెప్టార్ మీద యాక్ట్ చేసి ఆ రిసెప్టార్ కి అఫినిటీ కూడా చూపించి మళ్ళీ ఆ రిసెప్టార్ ద్వారా ఇంట్రెన్సిక్ యాక్టివిటీ కూడా చూపిస్తే దే ఆర్ కాల్డ్ యాస్ ఎక్సోజినస్ అగోనిస్ట్. అంటే జనరల్ గా మన అగోనిస్ట్స్ అంటున్నాం. సో డ్రగ్స్ అంతా కూడా మనం ఎక్సోజినస్ అగోనిస్ట్స్ అంటున్నాం. అంటే బయట నుండి మనం అగోనిస్ట్ ని పంపించి అక్కడ ఎండోజినస్ అగోనిస్ట్ ఏ పని చేయాలో ఆ పని చేసేటట్టు చేస్తాం. సో there is affinity and there is intrinsic activity. Okay. So this affinity and intrinsic activity which is shown by drugs, all these drugs are chemicals which are called as agonists. Okay. In cholinergic system, in parasympathetic system, there are some agonists which are considered to be esters. Okay. There are agonists which are considered to be esters. There are agonists which are considered to be alkaloids. Okay. Considered to be esters and there are agonists which are considered to be alkaloids. Alkaloids ante plants nunchi vachey. Okay. The agonists which are considered to be esters are acetylcholine. Okay. It is acetylcholine. Then you have carbachol. You have bethanacol. Okay. You have carbachol, bethanacol, and you have, I'll just rub this, and then you have methacholine. You have methacholine. Okay, you have acetylcholine, methacholine, carbachol, bethanacol. Ivanni esters. Alkaloids, you have arecholine, you have muscarine, you have pilocarpine, you have cevimeline. Ivanni kuda we are calling these as we are calling these as cholinergic. We are calling these as cholinergic agonists అని అంటున్నాం. cholinergic agonists ఏం చేస్తాయంటే cholinergic receptors మీద అఫినిటీ చూపిస్తాయి అండ్ ఇంట్రిన్సిక్ యాక్టివిటీ కూడా చూపిస్తాయి. ఓకే. cholinergic agonists will show affinity and intrinsic activity. Vaishali, alkaloids are plant-based substances. Arecholine, muscarine, pilocarpine, cevimeline. These are the 4 important drugs, okay, which are produced from plants. Acetylcholine is present inside the body. Methacholine, carbachol, bethanacol are some chemical entities which are present. These are all cholinergic agonists. Agonists are showing some affinity and they are also showing an intrinsic activity. Is this clear, all of you? Take this down. Yeah. Okay. I think we are at time. So what we'll do is we'll stop here and from here we will continue in the next session. Okay. You just take this down, take a snapshot and then we will continue with that. Okay. I hope you're able to follow. Okay. And if you're not able to follow, please look at the recording classes and you can get back with questions. Okay. Thank you. Thanks a lot. Verma, another one is called as coronal section. So Verma, can you remind it tomorrow or whenever I take the next class? One is